We will make these sessions available on our website.
Okay, thank you. So I can begin.
Yes.
Okay. Thank you all for being here and for being here during your lunch hour. Enjoy your meal if you're eating right now. And I'll talk a little bit more about our lab. Our lab is the Vulnerability, Trauma, Resilience, and Culture, better known as VTRAC Lab. And more specifically, I'll talk about how to provide anti-racist mental health care training that we offer. So I'll go over quickly what we'll talk about today, just a bit of background on our lab. I'm going to talk about some recent and ongoing projects so you can get a bit of an idea of what type of work we do. I'll also talk about recurring and future events. Events is a big piece of our work, and how we join the community and get the general public to hear about research. And then last but not least, I'll talk about the training, providing anti-racist mental health care. So for a bit of background, well, I'll introduce myself. My name's Liage Kima. I'm the research coordinator at the VTRAC Lab. I've been there for 2 years now. The lab is about 7 years old now, so it's been a minute. It was founded by Professor Jean-Marie Sena, a professor in psychology at the School of Psychology at the Faculty of Social Sciences at the University of Ottawa. He's also the director of the lab. We mainly work on vulnerability, trauma, and resilience in youth and adults. And our research is based on three main axes: vulnerability and trauma, racial disparities in health and social services, and global mental health. Um, did I forget anything? No. Some of our recent projects, our big project we've been working on for 5 years is the mental health of Black communities in the National Capital Region, evaluation, prevention, and intervention tools. This was funded by Public Health Agency of Canada, PHAC, from 2019 to 2024. During that time, we published about 20 articles on Black mental health in Canada, documenting the prevalence and associated factors for depression, ADHD, anxiety, substance abuse, all types of things. And these were a lot of firsts for Canada. We don't have a lot of studies on the Black communities in Canada and how they're affected by mental health. So that was great. We also focused on a lot on events and activities to raise awareness and mobilize the community. During the pandemic, we did a lot of virtual events, a lot of campaigns on social media. That's also how we started the Black Mental Health Conference that we do every 2 years. We've had one in October 22 and one in October 24. Um, and a bunch of events like that that just keep the conversation going and give access to the general public to all these activities we do. And then last but not least was creating some training courses and some educational content. We have a documentary coming up. We also then created the training that I'm going to talk to you about today, how to provide anti-racist mental health care. But we also have a more general training called Becoming Anti-Racist. That's really for everybody and specifically targeted towards the youth, just to raise awareness on racial issues and what it means to not only not be racist, but what it means to be anti-racist. And then we have also studies across the world. We do studies in Haiti, but we also did a study on the Ebola virus disease in the Democratic Republic of the Congo, where we assessed the situation in terms of mental health, whether that be of survivors, but just the surrounding communities, the healthcare workers, and everybody affected by the disease. We created a psychosocial intervention guide. Think of it as a first aid kit, but in a psychology sense, in a psychosocial sense. We also developed a prevention kit in consultation with the community organizations in the field. Our ongoing projects is the providing anti-racist mental health care to racialized communities, implementation and evaluation. So while we were doing the Black Mental Health Project with PHAC, we realized there was really a gap in the training that healthcare workers receive, mental health professionals specifically receive on anti-racism and providing culturally adapted and safe and sensitive care. So we created the training and got this funding with CIHR to really upgrade it, develop it even more, and implement it across various organizations in the city, in Canada, and in the world in general. In North America, most probably where it's the most relevant, at least to our research. Um, and part of this project was also to provide funding to community organizations so that they can implement it, but also evaluate it. Some other projects, we have a project on type 2 diabetes prevention in Black communities in collaboration with the Interdisciplinary Center for Black Health. And we also have research projects on vaccine hesitancy in racialized communities, really relevant topic ever since the pandemic, but just in general. And then we have a project on cyberbullying of youth in university and just seeing how it affects their mental health and their post-secondary university careers. Um, On to our events. We have the National Conference on Black Mental Health in Canada. It happens every 2 years. Next one is next year. The goal is to highlight the latest advances in research in Black mental health in Canada and bring all the actors in the fields, whether that be politicians, community organizations, health professionals, practitioners, and researchers. Um, this year, the last year, we also had the honor of giving honorary doctorates to prominent Black scholars. So it's really important to us to bring forth all the Black knowledge makers that work in the field, but also in Connex fields. We have the My Mental Health, My Country and I event as well. This event is for Black high school students across the National Capital Region. We have Black prominent figures come speak to them, usually public servants or politicians, just to talk about social engagement, community engagement, and kind of their journey to excellence and kind of to inspire and motivate our Black youth in the city. We also have a career fair that day, and this happens every year. The next one is in 2 weeks. Really excited for that one. And then in collaboration with the Interdisciplinary Center for Black Health, we have the Conference on Vaccination in Racialized Communities. This year is the last one. We've been doing it every year for 3, 4 years now. This one's the last one. I really encourage you to join if this is a topic that interests you. And then we have the World Sickle Cell Awareness Day every year as well in June. A very important topic as it touches the Black community more than others, and we touch on blood donation in the Black community. On the one hand, trying to dismantle kind of the stigmas and the misinformation regarding Black blood donation, but also um, examining if there are any racial biases in policies at the Canadian Blood Services, for example. Um, so those are the events, and now on to the training itself. So as I said earlier, um, during our project with PHAC, we noticed some big gaps in Black mental health and the care that not only Black communities receive, but also racialized communities at large receive. So we thought it'd be important to create this training to train mental health professionals and also evaluate the patient's experience. Do the patients feel heard? Do the patients feel like the care they receive is comprehensive, it's culturally adapted, and anti-racist? So I'll go through the website with you all right now, just to show you what it looks like and how to navigate the website. So this is what it looks like. I'm already logged in, but I'll switch to English. How to provide anti-racist mental health care. Remember to take the pre and post training questionnaires, very important. And just letting you know that you can take the Canadian Psychological Association exam to get a certification. It's at a $29 fee, but that's a possible certification that you can get. So you'd click here and you'd be able to create an account, and from then you'll be able to see the course. Now, we've set up the course so that you can only advance once you've gone through the module. So you'll have to go through each module to see the rest. And each module has quizzes for all the different sections. So after section 1, you have reflection questions on microaggressions, internalized racism, whatever the case may be. These are just questions for you to reflect on the content you've seen. And then at the end of the module, you have a quiz with a series of multiple choice questions. Just to go back at the beginning, you have a video to introduce the training. You take the pre-training quiz before anything, and then you can move on to the next lesson. And they'll introduce the module, what's the topic, what you're going to discuss, just an introduction, and then you'll get started on all the different aspects. And if we go down to the end, you have a conclusion video. You get, sorry, excuse me. Apologies. So yeah, you can do the post-training quiz, and then you would click here for the certification. Here's the pricing. And then you could do the test here. I think that covers the website. Did I forget anything? Okay, yeah, that covers the website. I'll go back to my PowerPoint just to give an overview of the topics that will be discussed in each module, just so you know a bit what it's about. Module 1 will be awareness of racial issues, understanding racial issues, examining one's awareness, developing cultural competence, analyzing the impact of racial issues, recognizing disparities in mental health care. So very putting the context, understanding the different social aspects at play. The second one is assessment adapted to racial issues. Understanding the role of assessment. So this one is very specific to mental health assessment. So understanding the role of assessment, understanding the specific components of an anti-racist assessment, conducting holistic and integrated anti-racist assessments, measures used to assess discrimination and its implications, and assessment based on strengths and protective factors. We have a humanistic approach to medication management, providing a context for medication management, considerations when prescribing humanistic medication management, We know that if you're not doctors, medical doctors, you're not prescribing, but it's important to know the different factors at play when we think about medical adherence to medication and helping our clients or patients navigate this issue, especially when we know that some racialized communities might be more hesitant. Interventions adapted to racial issues, addressing racial issues through intervention, utilizing culturally adapted interventions. This one again is very specific to mental health. And then module 5 is providing tailored anti-racist mental health care to children and adolescents from racialized communities. Learning objectives are understand the need to tailor care of youth from racialized communities, understand the factors affecting the use of mental health services among children and youth in racialized communities, accessibility and structures of mental health care, and avenues from implementing culturally specific mental health care for children and adolescents. This talks about the aspect of dealing with the parents in a productive and efficient manner, and the specificities of children and adolescents from racialized communities. That is about it. I think that's all for me. I will open the floor for questions.
Thank you again for your presentation. I'm going to, as I said, open up the floor for questions. I'm also remembering some of the questions that we received yesterday that we can also answer. But I see Brian has his hand up, so we'll go to Brian first.
Hi there. I work with Charlene at Archipelago HT as well. Thanks for that session. 2 questions. One, I think Charlene, you referred to it at the beginning. Did you say 9 hours is approximately the time for this? Okay.
Yeah, it's approximately 10 hours, yes.
And the other question was the target audience. Kind of between the lines, I took it's probably mostly clinicians and folks working with clients directly, but is it also relevant for, I don't know, planners and people working more at administrative roles?
Yeah, this is more geared towards caretakers, so practitioners, people who see patients and clients, nurses, primary physicians, psychiatrists, psychologists, and all of that. I mean, yeah, that's more what it's tailored for. Yes.
Thank you.
We got the same questions yesterday for the time that it takes and the target audience. But yeah, I'd like the clarification you gave now and yesterday. So definitely caretakers, clinicians, but not just mental health clinicians. Exactly. It can be primary care, it can be social workers, people that are in direct contact with clients.
Yes, exactly.
So we can share the link to, I'm seeing the Hoda's question in the chat. We can share the link to the website, but all of the info will be sent to you via email in a couple of days or weeks. So in that email, you'll also get the steps on how to sign up. That process is not super long, but you need to get an account, do a post or pre and post training survey. So all of that will be communicated via email. There's also an evaluation piece that's very important. So we want to kind of discourage people from going on the platform directly till we've done our work on the back end to make sure that we have something for our OHT. That way people can kind of select that they're OHT members and we get all of our data, which will be very, very exciting for us.
Yes.